So, my name is Malak Wissam Atwat. I'm a clinical nutrition and dietetic senior at UOS. I am a social media influencer, and I happen also to be a content creator as well as a public speaker. All right. The reason why I really got into this is because I very much enjoy to post evidence-based information as well as to debunk myths. Next slide, please. So again, as I was saying, today we'll be talking about 3 clinical conditions, and we'll be focusing on diabetes and hypertension. And then we'll discuss briefly the thyroid health. Next. Okay, first, let's start off by talking about nutrition and diabetes in Ramadan. Next. It's very important for us to understand the medical terminology of diabetes and why it happens. And it's simply just a chronic condition that is characterized by high blood sugar levels, of which we have 2 different types. Type 1, which is typically juvenile, meaning that it is a type that pediatric population usually has, which results from the immune system attacking the insulin-producing cells. However, type 2 diabetes, which often occurs to adults or older adults above the age of 40, which happens to also be multifactorial, meaning that it could either be because of genetics or it could be caused by lifestyle behaviors and factors. It often occurs or develops due to insulin resistance and insufficient insulin production. Both types are very, whenever we're talking about the nutritional aspects, we have to view them and treat them and monitor them in terms of carbohydrates because it has the most significant effect on the blood sugar. Next. Thank you. Now that we've talked about what is diabetes and the different types, let's talk about the nutrition management of diabetes. Nutrition plays a very important role whenever it comes to the specific chronic disease. Why? Because simply whatever you eat will reflect into or on your blood sugar. So by understanding how what you eat will affect you means that you are going to be able to make informed dietary choices, which will eventually help you to control your blood sugar and to reduce the risk of complications. Next. All right. Now, there are 2 main things that I would like to focus on here. Following balanced meals, and number 2 is monitoring the portion sizes of your food, and a third point, let's say, which is the glycemic index of foods. Now, whenever we're talking about a glycemic index of food, it means whatever you consume and eat, let's say, how severe does it raise your blood sugar? So let's say if someone consumes a piece of chocolate, that means that their blood sugar, it's this way. And then once they consume it, this is going to cause an immediate spike and then a sudden drop in their blood sugar. And you don't want that because it can cause a release of insulin, an immediate release of insulin, and it's overall not a good option for diabetic patients. Next, please. Okay, now whenever we're talking about balanced meals, it's very important to understand the composition of what's on your plate, meaning you have to understand the composition of the macronutrients. Macronutrients are made up of 3 different food items. We have the carbohydrates, we have the protein, as well as the fat. Now, why am I focusing on all the composition of the plate or all the different macronutrients? Simply because, yes, carbs do affect your blood sugar immediately, but pairing it with different macronutrients can help to stabilize your blood sugar. So again, what we worry about is carbohydrates, but it's very important to note that carbohydrates, back please, it's very important to note that carbohydrates are not the bad guy here. They're very important. They will help you sustain your energy, but in control. So this leads me to asking you a question about the carbohydrate types. I'm not sure if there is a chat here, but I'll just go ahead and say it because we're kind of late. We have 2 different types of carbohydrates. We have, next please, the simple and the complex carbohydrates, as you can see. And the difference is something that I'll explain in the next few slides. Starting off with the complex carbohydrates, and this very much is very, or like, let's say it's very related to the concept of glycemic index, because again, in that one example I gave you, which was a chocolate that caused that spike in your blood sugar, substituting it with something else that's paired with different items or a complex carbohydrate on its own can lead, such as, let's say, whole wheat, like brown bread, for example, can help your blood sugar to go up, but instead of doing that spike and drop, it will go up steadily and then it will just remain, steady and then drop again. So it will, number one, provide a steady and prolonged release of energy. Number two, so it's sustained, I would say. And then it will contribute to the feeling of fullness because you always hear dietitians telling you go for the brown bread, you'll feel more full than if you go for the white one. Yes, because there's fiber in it and it will help you to feel full. And it also helps in the management of weight, which is interrelated. If you feel full, you're less likely to eat more. And then it's rich in vitamins and minerals. Next. However, in the case of simple carbohydrates, such as the chocolate, it gives you a quick burst of energy, so you feel like you're so energetic and you're so happy right now. But then after this rapid shot, there's a decline, so you feel tired and just not as energetic anymore. And not only that, but it's also empty calories. Now, the foods that you can get the simple calories from are foods such as sugars, processed foods, chocolate, not chocolate with a high percentage of dark chocolate, but just sugary food items. Now, in Ramadan, these are the three major steps whenever it comes to diabetes. Overall health, I would say, but let's focus on diabetes right now. Number one, include more fiber. Number two, incorporate protein and fat into your meals because, as I told you, they get paired with the carbohydrates and they prevent that spike from occurring. And number three is to use strategies whenever you're planning your meals. And now I'll be telling you more practical tips and strategies. Next, please. All right. The importance of fiber. It will aid your blood sugar to be, just to get into control or to be controlled. And then it can come from sources such as oats, legumes, fruits, as I told you, whole wheat products. And also it helps in the digestive system. And not only that, but also helps lower the cholesterol levels, which we will get to when we go to hypertension. Now, protein and fat, they play a very important role, as I told you, because they stabilize the blood sugar somewhat if you pair them with the carbs. They include lean protein sources such as poultry, fish, tofu, and legumes. And then you can also incorporate healthy fat options such as nuts, seeds, avocado, and olive oil. Next. Okay, finally to the practical tips part, which everyone wants to hear. People don't want to hear just theory, they want practical tips. So first of all, you want to start with protein and fiber so that you keep yourself full before you go to your carbs. By doing that, I'm forcing you to not consume all of the carbs on your plate because already by then you're going to feel full because protein on itself has a high satiety factor, so you already are full, and then fiber such as a salad, that will also keep you very full. Number two is you want to avoid sugary drinks at iftar. Why? Because sugary drinks, from the name, it's full of sugar and it's an immediate simple carbohydrate that will spike your blood sugar up. And instead, you can go for 0-calorie sweeteners, such as stevia. Next. Okay. See this here right now, this plate? This is how I expect your iftar table, or like anyone who's diabetic and even a healthy person. This is how I expect your plate to look like. Half of it, 50% of it, will be fruits and vegetables. And then let's say we can divide the other half of grains and proteins. And then also dairy on the side. Next, please. Now, let's get to meal planning strategies. First of all, what you're going to do to prep yourself and just to be energetic the next day and not feel like you're very hungry or feel tired, you are going to have a meal that contains complex carbohydrates, which could either contain legumes like fava beans, chickpeas, okay? Or you could just go for a brown bread with a protein source. Now, that could be eggs, that could be cheese, chicken if you're making a chicken salad or a Caesar salad, and water with it. Why water? It's important to stay hydrated during Ramadan. And not only that, but if a person is thirsty and they are very dehydrated, that clinically has been proven to cause the person to feel, let's say, a false signal of hunger. So that on its own will eliminate that on the side. So if you're eating what you should be eating, or you're eating less, then less chance of carbs being consumed and more blood sugar is controlled. Then, when it comes to iftar time, you are going to break your fast with a date and water. It's very important to notice how, or not notice, but just focus on the amount of dates that you eat all at once. It's okay and it's great to have dates, but do not overeat dates, because dates contain a lot of, sugar, and they, like, the glycemic index of it will cause your blood sugar to spike. So maybe perhaps you can pair the date with almonds or with walnuts. Like, you can just, break it in half and just remove the seed, or cut it in half and remove the seed, and then add your nuts inside, and then you can eat that. That will help to just take down that spike. All right, and then water, as we said. Then when we move to a balanced meal, it is that plate that I have showed you, where you are going to be having half salad, protein, carb, and as I told you, what you should be doing is you should be consuming the protein and salad first, and then move to the carb choice. Whenever it comes to sweets, it is very important that you don't 100% deprive yourself from sweets. Because if, let's say, today I prevent myself from eating sweets and it's looking delicious, all of my family's around the dining table and they're just having a lot of good looking sweets. Maybe first day I'll have, let's say, the resistance and the resilience and be like, no, I'm not going to consume that. But then second, third, fourth day, I'm not going to have that. And instead, I might even have that, I might deal with it in the, wrong way, where I'll just be so deprived that I will overeat. Okay, so it is okay to eat sweets, but while, number one, consuming this much, so you look at your palm and you consume about this much of it as sweets, and then you also have to pick good choices. So if you're able to make some sort of, traditional sweets at home, where you add stevia instead of sugar, sweeteners that are 0 calories and zero carb content, or if you're able to add nuts to it, that will be a great option, because again, then you're controlling your blood sugar. And then avoid sugary foods and use alternatives. Now, this one red line is something that I often get a lot of questions about, which is avoid making and drinking excessive amounts of homemade juice. Next, please. So people are often surprised, because why? Like, why would I not consume a fruit juice when it's literally healthy? Is it not rich in vitamins? Is it not rich in minerals? And to answer your question, next, please. To make this 1 cup of juice, you need to squeeze about 3 oranges. Would you be able to sit in one setting and eat 3 whole oranges? I think you would not be able to do that. So instead of just squeezing and drinking, because then you're just taking the pure sugar and the fructose from the fruits and drinking it, causing that blood sugar to spike up. And even, because fruits, they have a lot of fiber, and when you consume it, at least you're having a bit of fiber, which will reduce this spike. You're just drinking it immediately. Now, it's important to monitor your blood sugar levels, because that will help you to understand how your body functions and how the food will affect you. It's important also to include physical activity and to see how medications as well as physical activity affect your blood sugar. Next. Also, do not forget to always write down the readings that you get. All right, now we're done talking about diabetes, nutrition and diabetes. Let's move on to talk about nutrition and hypertension. And I have a little bit of a quiz here that I'll get into. So hypertension is simply high blood pressure. And it's a common condition. A lot of people have it. And a big portion of it is just caused because of the diet and lifestyle factors. Next. Hypertension, if not controlled, can lead to so many different clinical conditions, such as atherosclerosis, CHD, IHD, myocardial infarction, CVDs, and PVDs. Next. So now that we understand the significance of it, what is a typical person's lipid profile who gets hypertension? So they're going to be having a high amount of LDL, which is the bad cholesterol, as people call it. They're going to be having a high amount of triglycerides, low HDL, which is the good, cholesterol, and then we have high cholesterol amounts. Next. Okay, this leads us to this question. People often link cholesterol with fat, right? So my question here is, are fats, all of them, are all fats bad? The simple, quick answer is no, they're not all bad. And as a matter of fact, there is a good amount of fats, a good type of fats that we always recommend patients to consume if they're having hypertension. Next, which I'll get into in a bit. Okay, now let's talk about my favorite part, the medical nutrition therapy of hypertension. Whenever you're talking about nutritionally managing your hypertension or even preventing it, but let's focus on the management, we have two types of diets. We have the TLC diet, which stands for the therapeutic lifestyle changes diet, and the DASH diet, which stands for the dietary approach to stop hypertension. Next. Okay, whenever we're talking about TLC diets, from the name, therapeutic lifestyle changes, it means that you have to change something about your lifestyle. So it mainly will focus on the physical activity that you do in a day, then the fat percentage that you're allowed to have in a day, the macro and micronutrient distributions, the soluble fibers, and the phytosterols. Now, when we're talking about the soluble fibers, why? Why am I focusing that much on it? Simply, soluble fibers are basically a fiber that you can find in things such as oats and citrus fruits, which is, lemons and oranges. What it does is that as a soluble fiber, it can come and it can bind to bile. Now, bile in our body contains cholesterol. So once it binds with it, instead of going and, because typically the cholesterol will go into the liver and get absorbed, instead of going there, it binds with it and it gets it out of the body. So less cholesterol, less chance of suffering from hypertension symptoms because less cholesterol overall. Then the phytosterols, next please, which is a very new medical term that I'll be introducing you to. Phytosterols, also known as plant sterols, are something, you can call them an imposter, basically, and their function is that they are very similar in shape with cholesterol. So what they do is at the site where, yes, thank you for the figure. So here what happens is typically your cholesterol is going to get absorbed into, just go into your arteries and into your veins. So because you're over consuming a lot of cholesterol, so your body has to do that, right? And then if they start to, let's say, accumulate, that causes a plaque formation, which eventually will cause the artery to stop, what's the right word for it? Overall, the blood is not going to be able to pass by normally, and thus hypertension and perhaps CVDs in the future. So what happens here is that phytosterol is going to act as an imposter. It will look like cholesterol in shape, and it will start to compete with cholesterol at the sites of absorption. So it will prevent it from going inside. So then it comes and it stops it from going in, and then less chance of accumulation of cholesterol. You can find plant sterols in foods such as soybeans. You can even find it in broad beans. Next. All right, so as I told you, we're focusing on the physical activity as well as the percentages of the fat. So in a TLC diet, we have three types of fats, or just generally three types of fats: MUFAs, monounsaturated fatty acids, and then we have polyunsaturated and then saturated fatty acids. This has to be the percentage of which they're distributed in order to remain under 30%. That way you are controlling the fat content that goes into your body, and it is what's recommended for hypertensive patients. Next, please. So you're probably wondering, what are the sources and are they all bad? And the answer to that is no. Number one is MUFAs. MUFAs could be found in things such as olives and olive oil, and then they are the perfect types of fat It's great. We always advise people to go for it. Unless you're trying to maintain your weight or just to lose weight, then perhaps you need to take care of the amount, because 1 teaspoon, a little teaspoon, has 45 calories. And then for number 2, which is the PUFAs, that contains fatty fish such as salmon, as well as nuts, and then saturated fat, which could come from the fat that is solid at room temperature, which could be found in butter, could be found in, meat, like the meat that contains a lot of fat. Next, please. Okay, moving on to the DASH diet. The DASH diet, the dietary approach to stop hypertension. Here, our focus is on specific food items that we aim to increase or decrease. So number 1 is increasing the fruit and the vegetable servings per day. A typical person, we usually advise them to have around 3 to 5 servings per day of fruits and vegetables. But when you're hypertensive, that goes up to 8 to 10 servings per day. The reason is because the fruits and vegetables contain potassium, and potassium is a great source to kind of counteract the role or the effect of sodium. And the higher the sodium, the higher the hypertension. Moving on to the low-fat dairy products. Low fat for sure. Why? Because the dairy products often have saturated fat, so we want to limit that. So we aim for low fat, 2 to 3 times per day maximum. And then increased plant-based proteins. Why? Because again, it will contain plant sterols, which is perfect in case you are aiming to control your cholesterol. And then include nuts and seeds 4 times per week, rich in magnesium. And then high potassium. These are like the key takeaways. You want a diet that's high in potassium, low in sodium, adequate calcium, and adequate magnesium. Next, please. Okay, here's the test. We have 2 questions that I would like you all to answer. Number 1 is, you see these are hot dogs, right? They're frozen hot dogs. Does it contain high levels of sodium? Please answer in the chat. If you know. If not, it's okay, I can explain it.
Yes, it contains.
Yes, okay. Anyone else? Thank you. Okay. 1 second. Okay, so yes, it does contain high levels of sodium. There is a misconception that people usually follow or they believe in, which is if it's high in sodium, it has to be salty. And that's not true. Whenever you're tasting something and it's salty, it's because the sodium is paired with chloride, right? And then once they're both paired together, that gives you that saltiness. But sometimes, in order to preserve foods like processed foods or sometimes even frozen food, what companies do is that they add sodium on its own. So it doesn't add that flavor, but because it's processed, it has to be there. Next. There comes the second question. Does this contain high levels of sodium? It's pudding, basically. Okay. Okay, someone wrote something. No. Okay. Okay. So, thank you so much for participating. But the right answer is yes, it does have a lot of sodium. And that is something that a lot of people think, and I understand why you wrote that. But as I told you, whenever something is processed, meaning you're not making it at home from scratch, you're getting it and it's there, let's say on the shelves, and it's, sold there, it has high levels of sodium. And to double check, because sometimes it might not. So for you to double check, what you have to do is flip it and read the the food label. Perhaps next time we can talk about cutoff points about sodium. Next, please. Okay. So to wrap up hypertension, there are hints to keep in mind. Number 1, limit the sodium, increase potassium, decrease saturated fats, because that will cause cholesterol and the plaque to form, and yeah. And then processed foods, try to limit them as much as possible. Increase omega-3 because omega-3 can help to decrease the amount of LDL, which is the bad cholesterol, and then MUFAs, which can increase, which again, like olive oil, they can increase HDL, which is the good type of cholesterol. Next. Okay, now here, let's talk a bit about the importance of hydration. It's very important that you stay hydrated, hydrate yourself at suhoor time, and then at iftar, and then between iftar and suhoor. Do not leave it till last minute and just chug like 2-3 liters all at once, because then you're not giving benefit to your kidneys, you're just overloading it. So try to sip 200 mLs every hour, or even a bit more every hour. Then uh, uh, okay, and then try to avoid caffeinated beverages. Next. All right, physical activity, as we talked about, it's a part of the TLC diet, which is very important. You want to have light to moderate physical activity after iftar. Do not overload yourself. Avoid hard and vigorous activity during the fasting hours, and then consult a healthcare provider before starting any sort of new exercise in case you have hypertension. Next, please. Okay. When it comes to medication management, it's important that you always consult a healthcare provider and be aware of the medication and nutrient interactions or drug nutrient interactions, because sometimes what you eat could affect the drug absorption and vice versa. Next, please. Okay. Whenever it comes to monitoring the symptoms, it's important to be aware when it comes to warning signs such as dizziness, weakness, palpitations. Uh, seek medical attention if any of the symptoms worsen, and then keep emergency contact information readily available, just in case. All right, very briefly about thyroid function monitoring. Thyroid here, number one, it's very important to take medications, like regularly. And then you want to ensure that you're doing the tests regularly. And then if there are any unusual symptoms, you have to consult with a healthcare provider. Next, please. All right. Now we're kind of coming to an end. It's very important to educate yourself as well as educate people around you about the importance of nutrition management during Ramadan. Also, you have to raise awareness about specific needs of individuals with diabetes, hypertension, and thyroid disorders, if you are certified to do so, and then share only and only evidence-based resources and information with communities and promote the health and well-being. In conclusion, the proper nutrition is extremely important, again, in the management of hypertension and diabetes, because nutrition plays a huge role, as we've already discussed. Little tricks that you do throughout your day can just stabilize your blood sugar or help you to decrease the severity of your hypertension. By following evidence-based guidelines and seeking support from healthcare professionals, your medical doctor, your dietitian, you can fast safely under these conditions. And then remember to prioritize your health and well-being during this month of Ramadan. At the end, I would like to thank you all so much for attending today. It was a very nice session. These are my socials right here. This is my Instagram, where I post evidence-based nutrition-related information through videos and static posts. And this is my LinkedIn, where I would love for you all to connect with me so that we can discuss nutrition-related things. Thank you very much.
Thank you, Dr. Malik, for sharing your expertise with us today. I'm sure our audience will appreciate your insights. It's the need of the hour that we realize and spread awareness with every contribution that we can make in any capacity. Remember that only the participants who attend the complete webinar and fill in the feedback form will get the certificate. So make sure you must fill out the feedback form and share it at the end of the webinar. Now, without any further ado, I'd like to start the question and answer session. All the participants are requested to write your questions in the chat box. We will take your questions one by one. Okay, so I have a question. What is the best time for insulin to inject during Ramadan, before Sehri or after Iftar?
Before, sorry? Could you repeat that again?
I'm saying, what is the best time for insulin to inject during Ramadan before Sahri or after Iftar?
All right. So if we're ever talking about the best timing to take your insulin, you should consult with your medical doctor. That is their field and they know better. But however, if we're talking about rapid insulin, it should be taken before your meal, about 10 to 15 times before it. And you should balance it based again on what you and your doctor, as well as your dietitian, have agreed in terms of insulin to carb ratio and all that. Hope that answers it.
When we should take multivitamins during Ramadan?
Okay, so whenever it comes to multivitamins, generally, I'm not a very big advocate of it because I know for a fact that if you do have, or your diet is a balanced diet, you do not need multivitamins unless you are 40 years or above, because then your body stores are kind of, you're not anymore storing, but perhaps rather than just using from the stores. So then taking multivitamins is great, but uh, you need to be aware about the brand that you're taking, the amount, by consulting either with a dietitian or just, if you have the capability to read through the ingredient list and the food label. And regarding the specific timing to take it, it depends. If it's like a general multivitamin, sometimes they would write for you, it's better to take it before the meal. Other times it's better to take it before sleep. So probably it's better to read what's on the brand that you got specifically because it depends on the content of it.
Thank you. Are there any special considerations for individuals with thyroid conditions regarding meal timing or medication intake during Ramadan?
Yes, there are specific considerations. We did not really highlight it today because there was just a lot to talk about whenever it came to diabetes and hypertension. So perhaps we can discuss it in another session because there is a lot of medical nutrition therapy that goes, and it's really just about the timing of the meals mostly. Perhaps we can have a second session about thyroid health.
Okay, we have one question in chat box. What should be quit for weight loss in Ramadan and what should be taken more?
Okay, that's a very nice question. I would say things that you need to cut off or just cut down on is the pure sugars, like the sweets. Try to cut down on that as much as possible. Not deprive yourself completely because, again, you kind of will end up taking revenge on yourself and just eating a lot and binge eating. So, what I would say here is cut down on that and then increase a lot of protein. Protein is great. It can help you to build muscle. It can help you to feel satiety. So then you will not binge eat on other things. And it'll just overall make you feel really full. So that is a great option. Also, if you're craving sweets and you are trying to limit your calories, what I would recommend is you go for fruits. We forget fruits at all in Ramadan and we just substitute that with sweets. So try to aim for that.
I'm asking about the medication schedules.
Yeah, okay. So timing and schedules of the medications, again, since I'm a dietitian, I can't really just tell you about the medication because it depends on the type of it, when you're consuming it already, what your medical doctor has told you, what's your, current state. Uh, so I would recommend that for such a question, it's better ask your medical doctor because even if I was a medical doctor right now, I wouldn't be able to just give you an answer. It's highly individualized, basically.
We have one more question in the chat box. Any specific diet plan for breastfeeding mothers in Ramadan?
Uh, okay, so if it comes or whenever it comes to diet plans and just specific things that you could follow, I do suggest that you DM me or text me on Instagram or on LinkedIn so that I can help you out with general guidelines and things that you can implement into your diet. But it's, if you want an answer for now, because again, it's very complex to talk about in this session right now, what I or like all dietitians will recommend is basically you need to increase your caloric intake by around 300 calories because you're breastfeeding and you're already losing a lot of energy and vitamins and minerals.
Okay, so we should end the session over here. Thank you, Dr. Malik, for sharing your expertise with us today. And I hope
Thank you.
everyone enjoyed the session because it was quite informative. So we are looking forward for more sessions with you. Thank you.
Inshallah. Thank you very much. I really enjoyed it today. And thanks for everyone who has attended and asked questions.